So first technique is going to be the anterior calcaneal manipulation. So we're going to brace the talus using the proximal hand, and then lateral hand wraps around the back of the calcaneus, and the important step is taking up the tension and then thrust, hold and release. Then this next technique is the posterior-talar mobilisation. So this time the medial hand proximal phalanx is going to sit in the neck of the talus. Distal hand will wrap around, or lateral hand is going to wrap around the posterior aspect of the calcaneus. Then just using body weight traction, and then dorsiflex the foot while dropping the knee down. So it's plantarflex the foot, dorsiflex using the hand, and working the talus posteriorly with the proximal phalanx of your medial hand. Third step is using the thenar eminence, placing that against the navicular, wrapping the hands and fingers around the posterior aspect of calcaneus. We're going to invert the forefoot to maximum, take up the tension, wings are out, and thrust, hold and release. Now I'm just going to throw in a couple of extra steps here. We then mobilise through the navicular cuneiform joint and the cuneiform metatarsal joint. So stabilise the proximal component, and it's just big circles working. Cool. Just going to palpate through the plantar cuneiforms. Kathy's in good shape, so nothing prominent, no cuboid prominence there, so that's good. Right. Check the metatarsal heads. Okay, and just going to top off with an activator. Good. Alright, now Kathy's knee, if we come up to this area here, I just need to do the wrist extension technique, which is a regular feature for Kathy. Good. And I can see her right femur is posterior, so we're just going to slide up towards here. This is utilising the drop piece mechanism. Excellent. Now, to utilise the drop piece on an anterior talus, we're going to work it posteriorly. Contact point, and then great, and then we go to the medial aspect of the tibia.